Welcome back. Now, the Public Health Department of Maharashtra has sounded a COVID alarm and has written to all top state officials. The letter cautions against a potential increase in the COVID count in the wake of a virus resurgence seen in countries like China, South Korea, Germany, and the United Kingdom. Shweta joins us live for more on this. Shweta, thank you so much for joining us. What has the government exactly said? What are the details of this advisory?
Well, yes, as far as Health Department is concerned, there's a letter which has come out from Additional Chief Secretary talking about the potential threat of COVID-19, which is again on the rise. And there have been certain points which have been highlighted by the end of Public Department. Followingly, it is first and mandatory that acceleration of COVID jabs should be increased as much as possible. And Mumbai has already seen more than 2 crores of jabs being administered. And also, stressing on the level of masking is very necessary, that mask should be always up, as again the infection is lingering around us. And also talking about the crowding should be avoided. Well, these are some of the important and crucial points that has been highlighted in the letter given by the Public Health Department of the state, and saying that now people should be extra cautious, as now again things are turning back and the COVID era can be seen.
Absolutely, Shweta. We all have to be careful. Thank you so much for joining us. We're also being joined by Dr. Subhash Salunkhe, who is a member of the Maharashtra Covid Task Force. Sir, thank you so much for joining us on this broadcast on Mirror Now. Now, in the backdrop of the world relaxing COVID norms in the hope that, the worst is over, how do you see this advisory that has come from the Maharashtra government?
Advisory is very appropriate at this juncture. As a matter of fact, even earlier, even before the present outbreak that is taking place in China, Korea, and other countries, we in the public health background, the people, experts used to say the same thing. So long as there is a circulation of virus anywhere in the globe, pandemic which is going on in globe, anywhere in any country, the entire globe is at risk. So the perception of some of the people in India and also in Maharashtra that, well, everything is okay and now the pandemic is over, certainly not. This is clear indication that till the time this kind of a development is taking place, we have to be extremely cautious. At this juncture, the kind of mutation that we have seen in India just few months back, the Omicron, is now at the full speed in the China and also in Korea. I personally feel it is not only the Omicron, but at this stage where globally Delta and Omicron both are now circulating, there is always a risk, and this risk is not insignificant, that there could be a further kind of an mutation that may take place. And under the circumstances, it is absolutely obligatory for us as Indians, not only in Maharashtra or Mumbai, as all over the India, to consider that we are not out of the woods, and at this stage we need to take all those precautions which have been enumerated and indicated by the additional CS Maharashtra. The first and foremost, what we could do and what public health or the government can do. As far as people are concerned, we have to follow those basic principles or basic precautions that has been told to us 2 years back. Masking, unnecessarily overcrowding must be avoided. The kind of pictures that we have seen on TV yesterday about celebrating Holi and subsequent last day or the second day on Dhulwad or Dhulivandan, I feel people have forgotten. Even now, people are not perceiving that this danger is lurking around. So this is a very, very critical. This is general population need to follow whatever has been indicated to them, proved beyond doubt that it protects us. As far as government is concerned, the surveillance part, which is already very, very clear one, for example, ILI surveillance, influenza-like illness, or severe acute respiratory infections, SARI, what we call. These conditions, wherever they are occurring, whether they are occurring in clusters, in a village, in a taluka, in a district, in a city, that need to be monitored continuously. And the viral surveillance is a very critical issue. As a matter of fact, I am recommending very strongly that it is not only the taking samples from the patients, but also environmental samples. That means collecting the sewage samples and subjecting it for viral isolation or sequencing of these samples to identify, to indicate whether such viruses are circulating, and if they are, what type of variant it is. Is it Omicron or it is getting something further? Because that danger is definitely there. So surveillance part is the responsibility of the government, municipal corporations, state governments, and the overcrowding, avoiding is a part which we have to take into consideration. And I think, my recommendation to the government, whether government will take it or not, some restrictions will have to be revoked. At this stage, everything is just removed. I personally feel so long as such a huge spike is occurring, 6 lakhs cases in a country of 1/4 size of Maharashtra, 6 lakhs cases in Korea. Can you imagine that? So what is it, indication that the, risk is very high. The only positive point as far as India is concerned, or Maharashtra and India is concerned, is that, see, we went through a very severe kind of an, cycle of Omicron infection just a few weeks back, or a month or 1.5 months back. That certainly has given us kind of an infection immunity to a certain extent. So that's a very positive point in our favor. Second very positive point in our favor is that we are already, say, nearly 180 crore population is vaccinated, either 1 dose or 2 doses. Even if it is 1 dose, also some protection is there, plus infection immunity. So both put together is giving us definitely an advantage. But the negative point, as I said, that people have lowered down their guard, which is negative from our perspective. So if we put it together, government and people, if they come together and ensure that same, heightened vigilance and precautions to be taken. I will be the last person at this stage to go to a cinema hall where there is a AC and where people don't use masks. I will not like to do that. So any overcrowded place which is having air conditioning, avoid that. Particularly senior citizens having diabetes or comorbidities, even though you may have taken 3 doses, 2 primary and the third one booster, please for next few months, avoid overcrowded places. There is no need. If you don't go to a movie house for next few months, doesn't matter. If you don't go to a restaurant for next couple of months, where if there is an open ground, if there is a possibility of air circulation, ventilation is good, then no problem. Please do not go to air-conditioned restaurants and theaters and places where there is overcrowding. All senior citizens, irrespective whether you have taken 2-3 doses, do not go. Absolutely. That's my recommendation. So some restrictions must be brought down, or must have to be, people, some people do not like to follow these restrictions. They consider as if that is, preventing their, personal freedom. That's utter nonsense.
Right.
Personal freedom has no relevance from public health. Right. If you are going to become, kind of a possible transmitter, certainly there has to be some restrictions. So I think government's advisory, that means Additional Chief Secretary's advisory at this stage to the state, is not only applicable for Maharashtra, it is applicable for entire country. It has to be followed strictly, which will help us in the longer run.
Absolutely. Dr. Salunkhe, thank you so much for joining us with all those valuable inputs. There is, of course, a sense of fatigue that's set in, but that is no reason why we should not, we should let our guards down. Thank you so much for joining us.